Okay. Assalamu alaikum, everyone. I welcome you on behalf of the Meme Foundation Women Wing. And this is part of our health and well-being webinars, which we have been doing it since we started our work as a charity organization, just to raise the awareness, especially among the BME population. So this one is a very important topic we want to discuss today, and it's about the mental health challenges in the BME women. So our aim is basically to raise the awareness and give you the advice on the mental health issues. Now, just the background is that obviously we are all aware of that the rates of mental ill health are much more common in the BME population compared to the white population, unfortunately. And I think the main reason probably is because there is a taboo associated with it and people don't want to discuss about the mental health issues. And therefore, I think the mental health issues does not come to the light in the beginning until obviously the things start getting distorted. The mental health issues include like anxiety disorders, depression, and there's the suicide risk. I mean, that's in the extreme cases, obviously. But then obviously, I mean, they are much more prevalent in the BME women. And I think we should be discussing it more frequently. So I think, I mean, what I think, I mean, being a doctor myself as well, that I mean, if there is a problem with any part of the body, we do discuss. So, I mean, obviously the mind or our mental health issue is a part of the body as well. So if there is any problem with it, we should come forward and discuss with our GP. And then obviously there are more issues and they can be referred to the experts like Dr. Bushra Rauf with us. So without any delay, I'll just introduce a little bit about Dr. Bushra Rauf, and then I'll hand it over to Bushra. Bushra is, mashallah, she's a consultant psychiatrist for people with a learning disability. And she's also a training program director for psychiatry in her region. And she's working at the minute in the West Midlands. Is it West Midlands, Bushra, isn't it? Yeah. West Midlands. And in terms of the background, she has done the MBBS, which is obviously is a basic degree for the doctors. And mashallah, then she has done the MRC Psychiatry, which is the membership of the Royal College of Psychiatrists. And she's also done the MSc in the mental health sciences, mashallah. And she's a full-time mom and a full-time psychiatrist. And so I'm really thankful, Bushra, for you giving us time with your busy schedule. So I will just hand over to you. So I will just request my participants, if you've got any questions, you can type in the chat box, and Bushra will be more than happy to answer those questions. Or if you want, you can, at the end, you can ask the questions verbally, and then it will be addressed accordingly, inshallah. So Bushra, over to you, if you can please start.
Okay. Assalamu alaikum, everyone. As you know, my name is Bushra. And thank you very much, Fawzia, for inviting me. Today, we are talking about mental health problems in BAME group, which is British Asian Ethnic Minority Groups, specifically in our own Muslim community. I have done my MBBS from Pakistan, but then I have done all of my...
You know James that used to be in my class, which I went to a science company.
Hello. Oh, sorry.
Sorry, Bushra. I think, yeah, there were some children in the back.
Okay, that's fine. That's fine.
Please request all the audience to mute everyone, and so that we can hear Bushra.
Okay. So, but I did all my training in psychiatry in UK. So I worked in I've been fortunate enough to work in different areas. Like I did initial training in Coventry, Warwickshire. Then I went to work in London, Kent. And then I came back, work in Birmingham. So I've actually worked in a lot of areas where I get to see lots of Muslim community and other ethnic minority groups. I'm at the moment consultant for Coventry, covering the Coventry city, which is again a very multicultural area. So, I am fortunate enough to know a lot of issues that are common in our community and other ethnic minority groups in UK. So I will be talking about those. So I will mainly be focusing on three main issues, which are very common in our community. And I have seen what usually happens, as Fawzia mentioned. We are actually very not very, forthcoming in terms of discussing issues with others or getting help. So when they come to limelight, they are actually quite worse. So the reason for today's session is to raise awareness, to make you aware what could be the different, how a mental health problem could present in our ethnic minority group, and what are the different signs and symptoms, how you can diagnose somebody around you if they are suffering with mental health problem, and what you could actually do to so that you can get help within time. Because the good thing is most of mental health problems are treatable. So this is the most important thing and reassuring thing that you need to know, that most of the time, and if they get picked up quickly, early, prognosis is good. It means that the chances of you coming out of it is good. And here in UK, mashallah, there is a lot of support available, as you know. Yes, from family wise, we are not having that much support as back home, but still there are other support available within the system, because psychiatry is quite well established field. So if you, God forbid, become mentally unwell, you have lots of support available. So first of all, the common problems that I have seen, and also that I read on literature, is most common is the depression. I would categorize them in two main categories. One is the mental disorders, and other are the developmental disorders. I would like to touch on developmental disorders as well, because I have seen that sometimes we cannot pick them up and we consider them as something else and start treating them spiritually, especially in our kids. When we find something different like autism or learning disability. So I thought I would touch upon those as well. But first, I will go through the main mental health problems, in BAME group, which is the British Asian ethnic minority group. So the most common mental health problem, there are three most common mental health problem that I've seen in our community. Is the first one is depression, second one is anxiety disorders, and third one is psychotic illness or schizophrenia. So it is also quite common, although we think that they are not common, but they are actually quite common. So in the first group, I will talk about these three main mental health problems. So first of all, we take depression. So as you, I don't know whether you know about anything about depression. Anybody? Does anybody would like to say anything, what they know about depression, or do you want me to just continue?
I think for me, Bushra, the depression is just feeling low.
Yeah.
Most of the time.
Yeah, it's a very good, yeah. The depression is actually when you feel low. The problem is it's important to know when you are depressed and when you are not depressed, because we as human beings feel low, miserable, lot of time, but not every time it is depression. So people can feel low, miserable. There is usually identifiable cause or stressful event that has happened, and following that you start feeling low. But most of the time we have our own coping mechanisms, support available, we get out of it, and it does not last for more than few days or a week. But when do you call it as a depression? Depression is when, yes, there is an identifiable cause, there is something stressful that has occurred, and you feel low and depressed most of the time, and most of the period, throughout that 2 weeks, and it lasts for at least 2 weeks or more, and also it affects your functional abilities. Is there a question? Sorry. No, I think that was okay. So the depression is when it lasts for more than a 2 weeks period, and also it affects your functional ability, and you feel low and miserable. So you are tearful. You may feel like crying most of the time. And how does it start? Normally, it starts people find mornings more difficult. So you feel low mostly in the mornings when the day begins. So you find it hard to cope that time. But as the depression progresses, because we know there are different severities of depression ranging from mild to moderate to severe, and then severe with psychotic problems. So in mild depression, people start feeling low and miserable mostly towards the morning. So they find mornings usually difficult. Some people may find even evenings difficult. So it's part of the day that you start finding difficult. But as the intensity increases, or as the depression progresses, you feel low throughout the day, and it lasts for at least more than 2 weeks, and it is affecting your functional abilities. So what are the different clinical features, how a person with depression could present? There are a number of different things that they could present with. Like first one is low mood, Second is they can complain of feeling tired most of the time. Like they say that I don't feel like having energy in myself. I don't feel like doing anything, So see how it affects the functional ability, that you feel tired most of the time. You don't feel like doing things that you would normally do, The third important feature, because there are three major signs of depression and others minor signs of depression. So major signs are three. One is low mood, and low mood is sometimes associated with feeling irritable as well. That you are not only low, you are feeling low, you are crying, tearful, and if somebody try to talk to you or discuss things, you lash out. You could lose your temper quickly, so you are agitated. You feel like on edge most of the time. And the second important sign is you have low energy levels. You feel like tired most of the time. You are unable to do things that you would normally be able to do because of poor energy levels. The third important sign is lack of enjoyment, what we call as anhedonia, that you don't enjoy things that you used to enjoy. Like we all have different habits that we enjoy. Some people enjoy watching TV. Some people enjoy listening to like Quran or Tilawat. Some people enjoy going out with their friends. Some people enjoy listening to music. So what happens when somebody is depressed? They start avoiding those activities. First, they don't feel like doing it because they are low. Second, they feel tired. They don't have energy to do things. And third, even if they do it, they don't enjoy it. So they have actually lost the interest and enjoyment in their usual activity that they normally find before depression as enjoyable. The other minor features of depression are it can affect your appetite. So on the effect of, you may feel, most common sign is that you lose your appetite. So you are eating less than normal. Somebody with depression, their appetite might reduce to just one meal a day, and even they are not finishing that meal. And as a result of that, they may start losing weight. It can go other way as well, because most of the time depression is associated with anxiety. When you feel agitated, you feel on edge, and sometimes you start eating more as like comfort eating, because you are not getting enjoyment in anything else, and you just eat as like a comfort eating. So it can most commonly associated with loss of appetite and with the resultant weight loss, obviously, because you are not eating much. But it can be increase in appetite with the resultant weight gain. Other minor feature could be that it can affect your sleep. Effect on sleep is very important to understand, because that also helps you understand whether you are mainly depressed or is anxiety your main feature. It is very important to identify that, because people with depression, first of all, what happens that their sleep get reduced. So normally, if they are able to sleep for 7-8 hours a night, their sleep would get reduced to maybe 3 to 4 hours. First important sign that you would see, when they go to bed, they could fall asleep easily, but they find it hard to wake up in the morning. So early morning awakening is there. So they normally wake up very early in the morning, like 3 o'clock or 4 o'clock in the morning. And once they are awake, sometime they will be able to go back to sleep, but sometime they might not be able to go back to sleep. But if anxiety is your main problem, then you find it hard to fall asleep after going to bed because you are still overworked, you are still thinking about things, and you are very anxious. So it takes you longer to fall asleep after going to bed. So you kind of like find yourself turning and tossing in your bed for maybe a couple of hours before you could actually fall asleep. So, but most common feature is this, that your sleep is reduced, what we call as insomnia, which is difficulty sleeping, early morning wakening. But sometimes some people with depression, they may sleep more than usual. They just, because of their increased tiredness, they are just sleeping like many hours, because they don't feel like enjoying anything. They are not engaging in any meaningful activities. So they just spend time by lying down in their bed or sleeping. The other important features that you could see is difficulty concentration. Like sometimes when you are depressed, you cannot focus. If you are reading book, you cannot make out what does it mean. You find it hard to concentrate on a TV program that you would normally easily do. So it affects your ability to focus or concentrate on things. Other effects could be like it can affect your personal life as well in terms of your relationship. You may feel like having no interest in your partner, and you don't enjoy spending time with your partner as well. Other features, as depression get worse, it can actually sometimes, it starts with all negative thinking, so you find somebody with depression, they come up with lots of negative thoughts. They feel that they are worthless, that life is not worth living. They feel like they are helpless, nobody could help them, and they feel like they are useless. And also they feel hopeless about their future. So as it progresses, it leads to a situation where you are totally hopeless about your future. So it all starts with all those negative thoughts, what we call as negative cognition. This is very important to understand because when I talk about the treatment, you would see how we deal with all these thoughts in the treatment as well. So it starts with all negative thinking, and as the depression progresses, it gets worse, and your thinking changes to more, in a severe cases, in a suicidal way. That you start feeling that life isn't worth living, I am useless, I am worthless, I have got no future, I'm hopeless. So I should actually die, or I'm no use for anyone. And they may actually start thinking about it. They may sometime act on those thoughts and actually do something to themselves, maybe taking overdose or cutting themselves. And they may start making plans. So if somebody with depression is talking about any suicidal thoughts, you need to take it very seriously. And I would rather say, don't ignore the initial signs and symptoms of depression, because if you ignore them, it would lead to a severe depression, which presents with not only suicidal thoughts, it can also present with aggression to others. Like somebody who is severely depressed, they are very agitated, they could lose their temper quickly, and they can be verbally aggressive or physically aggressive to others. So, and another risk that is there in severe depression is they can become psychotic as well. Severe depression, after a few months, you start developing psychosis as well. Like you may start having experiences which you would normally wouldn't have. They are unusual experiences, like hearing voices when nobody is around, or seeing things which other people can't see. So they are kind of what we call as auditory hallucinations, visual hallucinations, or other psychotic features that you could present with that are not in keeping with your cultural background or religious beliefs. You may come up with some beliefs that are quite abnormal. So I came across one lady who was quite depressed, and her belief was that she's already dead and she's not alive. And when I even asked that who is this person sitting in front of me, and she said it's a dead person. So that's how how worse it can be. but it starts with the mild depression, then it can be moderate depression, and then the severe depression. So severe depression, it can be associated with suicidal thoughts, risk to themselves, risk to others in the form of aggression, and risk secondary to psychosis. Because sometimes when they are hearing voices, voices may be telling them to do things, voices may be calling them names, voices may be swearing at them, and they find it so hard to cope with those voices that they start even hitting their head, self-harm. They may start acting on those voices if they are telling to harm somebody. So they may be having like command hallucinations where they are asking them to kill that person, or they may develop some abnormal beliefs like paranoid delusions, like people are trying to harm them, people are trying to poison them, the food is being poisoned, people are plotting against them. So these are all the psychotic symptoms that you could actually see in somebody with depression. So we have talked about a lot about how depression could present, but why would somebody be depressed? Because we all have challenging times in our life, but we are able to survive. But what happened? Usually depression is precipitated by a stressful event in your life. It could be losing someone, bereavement. It could be losing a job. It could be losing your, important things that you actually love, So it could be like losing something or any stressful event that happened in your life. Sometimes the trauma can also bring it on. Like if you are exposed to severe trauma, it could be in any form, like people who go, they can have a, difficult relationship for a longer period of time. That can also result in depression. So sexual abuse, physical abuse, verbal abuse, that can also bring on depression. It also runs in families, so genes also play a role. If you have in your first degree relative somebody who has suffered with depression, you are prone to develop depression, in yourself as well. Other things that can bring it on is use of alcohol or drugs, which is quite common in this country. If you are drinking alcohol or taking drugs like cannabis, cocaine, these things, they actually make you happier or elated for a shorter period of time. But when they come out of your system, you start feeling depressed and anxious. So you drink more or you take more drugs to make yourself happy. But then when again it is coming out of your system, you feel even more depressed. So you go into a vicious circle of drinking and taking drugs, but at the same time, you are not coming out of it. Because you are drinking more to cope with that low feeling that comes out when this level of alcohol or drugs goes down in your body. And in the longer run, if you are drinking alcohol or taking drugs for longer period of time, you develop depression or psychosis. Then certain physical health problems, like if somebody has suffered with like a serious physical illness like cancer, life-threatening illness, long-standing illness like pain in joints, arthritis, which is quite common in our society, in our cultural background. If they suffer with like diabetes, heart problem, that are like long-standing illnesses, even a thyroid problem, hypothyroidism, can make you feel depressed as well. So it could be an organic reason underlying why you are feeling depressed. So these are how you present and why you can become depressed. Now we talk about what needs to be done, how it is treated, because this depression is a treatable illness. If you present with a mild depression, which is like you have like one or two of major symptoms and some of the minor symptoms, the treatment is usually a psychological treatment. So whenever you feel like you are having depression or somebody around you you think is depressed, you need to encourage them to go and see your GP first. And when they go and see the GP would be able to assess whether they are suffering with mild, moderate, or severe depression. If it is mild, the recommendation is you don't need to go on a medication. You are treated with psychological treatment. Here in UK, a very well-established group that provides services is IAPT, where you will get referred by your GP, or you could actually make a self-referral to them as well. So which is improving access to psychological therapies. They can provide treatment because the psychological treatment is the mainstay for depression, especially for mild to moderate, where they treat, there is a specific type of treatment, what we call cognitive behavioral therapy, CBT. Why this treatment is important and how does it work? Here comes those thoughts that I talked about previously, that depression is all about having negative cognition, negative thoughts in your head. So CBT works, the myth behind CBT is it's a cognitive behavioral therapy. So when you feel negative, so you have negative cognition in your head, you feel negative. So negative thoughts make you feel depressed or negative. And as a result of that, you present with a negative behavior. Like you would just stop meeting with people, you would just stay in your room, you would stop socializing with others or do things that you normally enjoy. So see how negative thought lead you to feel negative in yourself, and that actually result in you presenting with a negative behavior. And it could be that much negative that you may start harming yourself to get rid of that feeling. So what happens in CBT? A therapist, you work with therapists, you normally have at least 10 to 12 sessions, once a week or twice a week, depending upon how you could do it. And what they do, they discuss with you about your thoughts. They help you understand your thoughts, how they are negative, and how you can change them with a positive thought. Because if you think positive, you will feel positive and you would then behave positive. Like if I give you an example that we give to all clients when they come for CBT, and it's a very easy example to understand. You go to a supermarket, you see your friend, and you say hello to her, and she doesn't reply, and you immediately think negative. Oh my God, she has ignored me. Oh my God, I think she doesn't like me. You go home, you think negative, and you start feeling low because you are thinking negative. So that will make you feel unhappy in yourself. And as a result, you would say, oh, she ignored me, I'm not going to call her back because she actually ignored me and she doesn't like me. So see how negative thoughts led to negative feelings and then negative action. But once, like a similar person who goes to a supermarket, see a friend, she say hello, she does not respond with hello. A person who is more prone to think positive would think, oh, maybe she was busy. Maybe she was busy with kids. Maybe she has not seen me. Maybe she was thinking something else in her mind. Maybe she's going through her own problems. So you think positive, you come back home, you feel okay, and you, oh my God, I think I should call her to check whether she's okay or not. Maybe she was having some problems in her head that she was thinking and she did not reply to me. So you end up calling her, and then the communication starts. So see how thinking positive leads you to feel positive, and then it leads you to behave in a positive way. So that is how the CBT works. Other treatment is, sometimes some people, they have difficult childhood. Early childhood trauma can also make you feel depressed later on in your life. So for them, there is a specific kind of therapy which we call at psychodynamic psychotherapy, where therapists would see you again for at least 12 to 16 sessions, and they talk about things that has happened with you in the past, and don't worry about it. Whatever you discuss with your therapist, it's all confidential. They've never discussed those things even with their supervisors in detail. They just discuss things, what is important there, and to get some brief idea how to deal with it. But everything that you discuss with your doctor or your therapist is all confidential. So in psychodynamic psychotherapy, you discuss about your childhood experiences. They make you go through that again, but in a positive way, how you can change your feelings around that experience. Because we all have difficult patch in our life. Nobody's life is perfect. We all have problems, but the way how we respond to problem is different. If I have a problem, I have my own coping mechanism. Somebody else has a problem. Sometimes they don't have a coping mechanism and they end up feeling depressed or self-harming when they have problem. The other mainstay of treatment for depression for moderate and above is antidepressants. Antidepressants, because what happens in depression, it's not on, in our culture, people usually say, oh, this is just, oh, you can pull yourself together, you just read Quran or listen to Tilawat, you would be fine. That is fine. Those things, they do heal you. They do make you feel relaxed. But at the same time, we have to treat the problem as well. That's what our religion teaches us. So what happens in that, in depression, it actually occurs due to the imbalance of chemicals in your brain. And there is one specific chemical which is called serotonin that actually reduces. So what happens, what antidepressants do, they work on different receptors in your brain and they help in increasing the level of that chemical, which is called serotonin chemical, which is like a happy chemical, or even other chemicals like that makes you feel happy. So people with mild depression, sorry, is there a question?
No, sorry, Bushra. I think somebody else.
That's okay.
Yeah,
So for mild depression, even we recommend them to have a healthy lifestyle. So for mild depression, you could be given psychological treatment, but you would be given advice like having healthy lifestyle, do a regular exercise, because when you do exercise like brisk walk or brisk exercise 20 minutes a day, that actually releases happy hormones in your head, and that can also help you in coming out of mild depression. Having a good sleep routine helps you in coming out of mild depression. Having a fixed bedtime routine, same place to sleep with, don't use good sleep hygiene measures like having a bath before going to bed, having a warm glass of milk, or and don't spend much time on screens 1 hour before going to bed. So all these things, they can help you to improve your sleep and hence improve depression. Healthy eating also helps you with depression. Antidepressants, most common are what we call SSRI. They are the first line treatment, selective serotonin reuptake inhibitors, but there are other antidepressants as well. But normally these are started. GP could start you on antidepressant, like most common is fluoxetine or sertraline. They usually start you on a low dose, see you in 2 weeks, explain all the side effects, and they see you in 2 weeks to make sure that you are tolerating it well. And if you are tolerating it well, they would increase the dose, and then they would see you after 6 to 8 weeks. Because antidepressants, they usually take 4 to 6 weeks to kick in. It's not that you start taking the medication and you are fine next day. It will take 4 to 6 weeks to bring that hormone level at a certain level so that you start feeling happy. So antidepressants is also a mainstay of treatment, especially for any depression which is moderate to severe. Then in some cases, severe depression, as I mentioned, people may develop psychotic symptoms. And usually GPs, they treat depression if it's mild to moderate. If it is above than that, and if the risks are high, they make a referral to secondary care to us in psychiatry, and psychiatrist would see you. And then you would you can have other treatment from psychiatrist as well. That would include psychotherapy, the antidepressant. They can even consider giving you antipsychotic medication to treat the psychosis if you have developed any, with the depression. In very severe cases, if people are not improving, they may end up coming into hospital, especially if there is a risk to themselves or others due to suicidal thoughts or thoughts of harming anyone else. And they may get detained. Here we use Mental Health Act. If somebody needs to get into hospital, they don't have capacity to consent, they are severely depressed, and they are not agreeing to informal admission. Informal means without the use of Mental Health Act, with their will. We can actually detain them. 2 doctors need to assess them with a social worker, and then they detain them and they bring them in. They get treatment. Once they are better, they can be discharged then. But that happens in a very worst case scenario. If your depression is worse, you may be given a community nurse, when you are known to a psychiatry team. Along with the psychiatrist, you would have a community nurse who can come and help support you at home. Some people, they start finding difficulty with their day-to-day activities, so occupational therapist would be involved, who can do their daily living assessment and see what sort of activities they could do, how they can actually keep themselves busy. If you are having any social issues, you may be given a social worker who can look into your accommodation needs, whether you need some carer coming in to support you with any day-to-day activities, or do you need to move out to another place, if you are not coping well where you are at the moment. So when you don't feel that you are alone, when you go to a GP, it's important to ask for help, at the right time, so that people can get involved. There are lots of charitable organizations, lots of focus groups that the psychiatrist or a GP could guide you, that you could join with people who are suffering with depression. I'm just mindful of time, so I would quickly go to the anxiety disorders. I have spent most time on depression because anxiety disorders, I will be talking about three main things. One is the generalized anxiety disorder, when you feel anxious all the time, but it has to be present for at least 6 months. Panic disorders are that you feel anxious in certain situation and it come like as a panic attack when you have some psychological changes, thoughts going on in your head, and some changes in your body. Thoughts could be thoughts threatening, life-threatening thoughts, fearful thoughts, thought that something bad is going to happen to you. And physical symptoms could be in your body when you are anxious. It's heavy breathing, dry mouth, you're shaking in your hands or feet, jelly legs, you feel like weird feeling in your stomach. So all these are the signs of severe anxiety. And in that, the panic attacks, it can last for few minutes, few seconds to few minutes, so panic disorder is when you get the surge of anxiety or attacks of anxiety. It can happen on daily basis, once a week, or more than that as well. Other are the phobias. Some people, they are afraid of heights, so it could be that phobia. They are afraid of people, social phobia. They may have other phobias like spider phobias or other phobias. But the mainstay of treatment for anxiety disorder is also, one is the psychological treatment, and the second is antidepressant. But for the treatment of anxiety disorders also include obsessive compulsive disorder as well, OCD, where you get repeated thoughts, and as a result of, like, somebody's getting thoughts, my hands are dirty, and they do some actions repeatedly which are called obsessions, like they keep on washing their hands, because as they stop they get more thoughts. Oh no, my hands have got germs, so they are washing their hands. So there are obsessions there and they can't just stop themselves, and their hands are being cracked. So this is called OCD. So there are a number of different kind of psychological treatment that we could offer for anxiety disorder. Main is cognitive behavioral therapy. Second is exposure and response prevention, or even breathing exercises that your therapist would teach you, because when you are feeling anxious, you breathe heavily. As a result of that, you actually inhale oxygen, but at the same time you are exhaling the carbon dioxide, and more you exhale, carbon dioxide washes out. It actually makes your anxiety worse. So what they make you teach, they teach you breathing relaxation techniques, where you take a deep breath in, count to 5, 1, 2, 3, 4, 5, hold the breath, and then bring it out. And they also teaches you some breathing exercises along with the relaxation techniques, how you can relax the individual parts of your body. And once you do them regularly, your anxiety disorder could improve. The third common type that we said is common in BAME group, which is British Asian minority group, and in our culture is being psychotic or schizophrenia, which is a very, I must say, the schizophrenia, the prognosis is 50-50. Some people, they can recover out of this. Some people, they may stay with some symptoms, but some people, it is lifelong illness. So, but important thing for that is to be diagnosed early and treated early as well. So in schizophrenia, what happens, you present with, as we mentioned, other psychotic symptom, like having experiences which you normally wouldn't have, like you hear voices when nobody's around, you see things, visual hallucinations that are not there. You may feel like there are sensations on your body. like abnormal perceptions in the form of, something crawling on your body. You may have some abnormal taste in your mouth, like gustatory hallucinations, or even the smell, olfactory hallucinations. Others are delusions, where you have abnormal beliefs, like some people, when they are like, they may believe that they are, God forbid, they are God, they are king, they are the prime minister, things like that. Or they may start having bad beliefs, like people are against them, they are trying to harm them, something bad is going to happen to me, you know so things like that. Somebody is able to control my body, and as a result of that, they may become aggressive. But not every schizophrenic is aggressive. This is very important, because it's a very common thing that people say, that it's aggression. You are aggressive, you are schizophrenic. Not everyone with schizophrenia is aggressive. For schizophrenia, treatment again is antipsychotic medication. Schizophrenia is usually diagnosed by specialist services. So you would go to the GP, they will refer you to the psychiatric services. They will diagnose you and start you on the antipsychotic treatment, which you will have to take at least for 6 to 12 months. If you get better, you may be able that they can reduce your medication gradually and stop it, and you may not get the illness coming back. Important thing for treatment of any mental disorder, I must say, when you are started on a treatment, whether it's for depression, anxiety disorder, or schizophrenia, you have to take the treatment for at least 6 to 12 months after you feel better. After you feel better, not from the start of illness. So if you are started on antidepressant and after 4 months you start feeling better, you should at least take it for 6 to 12 months. And then with the help of your doctor, the doctor will gradually reduce the dose and stop it. In that way, you are less likely to have your illness coming back. But if you just abruptly stop your medication, the chances of you getting illness coming back is more. So some people with depression, it could be like unipolar depression, or it could be, you might have heard a word, bipolar disorder, where it is like they have some episodes of depression that last for a few weeks, they are fine. And then they have an episode of feeling very happy, excitable, on the top of the world. They feel like they have got special powers, lots of energy, and that lasts for at least a week or more. So if they are having those episodes, they are more likely suffering with bipolar disorder. In that, your consultant psychiatrist, that is also, you need to be under specialist for that. They can start you on a mood stabilizer, that can help you stabilize your mood. You can be given benzodiazepines to reduce your anxiety levels, quick anxiety level reduction or psychosis, and also you can be given the antipsychotic medication with that to treat your bipolar disorder. So these were the most important mental health problems. Other problems that I need to mention is developmental disorders, because I know we all are parents, we have kids, and we actually tend to ignore these, and we don't accept these, that this could happen to our kids as well. But unfortunately, 1 in every 4 boys in this world, in this country, suffers with what we call as autism. And autism is a developmental disorder which affects the way you interact with people, social interaction, your communication, and you have restricted repetitive interests, like you have like fixed interests, or you have fixed routines to follow. And in children, how it presents, that they are like, they don't feel like mingling with others. They tend to spend time on their own. They have no imaginative play, like small kids, they play like as if with a brush they will be flying an aeroplane. But kids with autism, they have very less or minimal imaginative play. Their social interaction is very poor. They don't like talking to others, or they are very shy kids, aloof. They tend to just enjoy their own company. They have very restricted interest, like they would just like to watch Thomas the Tank, or they have just interest in collecting the cars, and they have fixed routine. And if the routine is broken, they get very anxious, or they can present with a lot of behavioral issues because autistic people, they have higher anxiety levels than normal. So that is also a very common developmental disorder. Other important, because I work in learning disabilities, I need to mention that, and I have seen parents from Asian background or ethnic minority group, they actually don't accept that their kid could suffer with learning disability. Learning disability is when the child mental age is less than their physical age. They, their development is delayed, like they are slow to talk, slow to walk, they have feeding problems when they were young. And when they grow, they are 5 years old, but their brain is like 2 years old. Even when they become 12 years old, their brain is like 5 years old. And they find it difficult to learn new skills. They find it difficult to do the more executive kind of functions like using the hob, using the microwave, or using the washing machine on their own, and they need help. And learning disabilities also on on different ranges, like mild LD, moderate LD, severe LD. So as the intensity increases, you are more dependent on others. So unfortunately, the developmental disorder, if you are born with autism or learning disability, we cannot treat that, but we can help you not develop mental health problems, because people with LD and autism, they are 4 times more common to develop mental health problems. They are 4 to 5 times more common to develop behavioral issues. So we can help them to reduce their anxiety level, to manage their behavior, so that they could have a good quality of life. Other important developmental disorder is called ADHD, attention deficit hyperactivity disorder, where your child is hyperactive, they are on the go all the time, they blurting answers, they are interfering with they can't have two-way communication, they have to interrupt others, they can't focus, they are inattentive, very poor concentration. So in that we use, but for that the medication is available. It is a developmental disorder, and good thing is with ADHD you grow out of it after some time when you are like in adults. But there are a lot of medication that we could actually give you to help you focus. And I have seen kids, when they were not on anti-ADHD medications, they were unable to focus on their schoolwork. Their school performance was very bad. Once they are started on medication, they could focus, they could sit, they could work. They have to take a medication. It's like diabetes, like taking medication will keep your diabetes controlled, and they will keep themselves controlled, and they would be able to achieve in their life. And after, when they are adult, gradually they can come out of the medication, because you grow out of ADHD. It actually improves your hyperactivity and attention, actually improves when you grow older. And it's similar with the LD and autism, that if you are suffering with high anxiety levels or any mental health disorder, because you are more prone to develop that, if you get it treated, you are more likely to have a good quality life. The problem with mental disorder is, and why I like psychiatry is, important thing is, when you have a physical health problem, it just affect, you have a heart problem, affect your heart, and it has got some effect to your family, like somebody has to look after you, but it does not affect the other family member in a way when somebody with mental disorder occur in your family, because it upsets the whole family unit, and when you treat somebody with mental disorder, you are actually treating the whole family, because the whole family will get their life back. Hence, in psychiatry, we have multidisciplinary teams, MDTs, and we work with a big team. Like in my team, I am a psychiatrist, I have a psychologist, I have occupational therapists who help with their day-to-day activities, speech and language therapist. If people are having problems with communicating, they can support them with that. Physiotherapist, if people are having difficulty in walking, their mobility is affected, they can help support them. And also, we shouldn't ignore the underlying organic problems. That's why we work very closely with GPs. We ask them to do the blood test to rule out any physical health problems, and even before starting you on any medication, so that we make sure that you don't develop side effects if you are taking psychotropic medication for a certain period of time. And you would be seen in the clinic regularly. Most of my patients that I see them are like 2 to 3 monthly. Some of them who are now feeling better, improved, I see them 4 to 6 monthly, like twice a year. And few of my clients are actually once a year, I just see them to make sure that they are doing well. you know. And once you do well, psychiatrists will discharge you back to the GP. So it's not like that you are alone. There is a lot of help available. So if there is any problem, my take home message would be, we feel mental health problem as a stigma. We should take it as an illness, and it's a treatable illness. So if you ask for help, if you get help within time, chances of you recovering from that illness is quite a lot. But if you delay it, you just try to treat it with other things and see that things would get better, but actually things get worse with time, then the prognosis get worse. So my take home message is that you have to be very vigilant around you, people around you, and yourself. Self-awareness is very important. In our community, I think we don't pick up things quickly. So we need to learn about these things and try to pick them up quickly so that we can arrange for help quickly. Thank you. I think I've talked a lot. There may be a few questions. I don't know. I can't see the chat if there was.
Yeah, there is a chat box here, Bushra.
Oh, yeah.
I don't think so. Yeah,
Okay.
there's some touch here. Thank you very much. That was really good. I think Sarab wanted to ask a question. So Sarab, you can unmute yourself.
If you not mind, I not understand everything, but very good talk. First, I want to say really, really, to me, beneficial. I wish we had often talk like that. I think even myself, what doctors say, you know, I feel like I have, I don't know, anxiety or depression, and what is she mentioning about you know, like psychology, physiotherapy, you know, but how is now during coronavirus hard to see anybody even increasing. I talking about myself, but I not see a way how to find way to speak to somebody or take advice. I've been on medication. They put my medication very low, but I think so my mood coming now more up. You know, like I think so need be increased, but GP can't increase or decrease without psychiatric doctor.
You are right.
I wanted, yeah.
Yeah.
Sorry.
In COVID, things have been difficult. You are right. Things are not easy. They are quite challenging. Most of the people are working from home, but we are offering lots of video consultation via MS Team, Attend Anywhere. And for urgent cases, we do go out and see people. So, so help is there. And I can understand with the GPs, they don't feel as expert in treating the mental health problems. So they cannot increase medication as confidently as a psychiatrist would do. So I would, in your situation, would go and ask the GP and request them to refer you to a psychiatrist so that you can be seen by specialists who could actually make changes and see if there is anything else that could be done. Because treatment is not only medication, as I've said, it's like a multidisciplinary treatment, you know, and that's how things get better more effectively rather than just being on medications. I hope I answered your question. Okay, thank you.
Very good. Yeah, you know, I am really appreciated. And if you not mind, can anybody send me that link or anything what we can watch or what we want? I think so. I told you they now cutting. I asked my GP to see specialist. You know what they tried? They said, "Oh, are you harming yourself?" You know, this is to me, not must be harming yourself to see psychiatric. You know what I mean? Or harming somebody else. You know, not easy, be honest to you. Even I've been maybe rude to my GP. I said, you can be psychiatric. I said, why they specialize for that? I said, please, but I think so maybe of money, because government may be now not giving enough money. I think so even GP, not all of them, like what you mentioned, to send on time patient to not go worse. You know what I mean? Because my English second language. And what, I begging, and end of that, she sent somebody to see me. And you know what lady came, good lady, she said, oh, do you want to go out somewhere? I said, I am not very physically good. I have problem now, not just mentally, even now what you say affect physically, like walking, like falling down, like, losing what is like balance. But they still don't know. Is it mental problem? Is it the arthritis? Is it, I don't know, be honest to you. I told you, I've been within Show Hospital quite a while. Then exactly what you mentioned, they discharged me, put me to GP. After years, of course, it's going up, down. I try and, because my consultant take off medication, he left me on low dose because he think, okay, I was okay that time, true. But now very hard to see again consultant to speak and put my medication up.
But you can ask your GP if he cannot refer you, he can actually increase the dose of your medication. You can tell him that has actually helped you in the past. Have you tried, apart from medication, the IAPT, where you can self-refer?
No. You know what is, I've been on medication, I told you, long time, and they put low dose now, but I feel now I need to increase with my medication.
Yeah, you can ask.
I feel easily upset.
Yeah, you can do both things. One, you can ask your GP to put your medication up because that has actually helped you in the past. And a lot of GPs could actually increase the medication. And if they don't feel like doing it, they have to refer you to specialist. Second, self-refer yourself to IAPT, IAPT. If you Google that, it will open up your local IAPT service, which is like...
if you not mind, sorry, what is A?
I will just write it here. IAPT, IAPT.
Thank you.
Yeah. So if you Google that, this is improving access to psychological therapies. You can self-refer. You don't need a GP referral for that. And you can tell them that you are feeling anxious, you are depressed, you have tried medication. They will offer you some psychological support. Because the evidence suggests if you take both the medication and psychology treatment, you are more likely to get better.
Thank you.
Jazakallah. Thank you.
I never heard about this. Thank you.
Yes.
So this IAPT would help you. Yeah.
Inshallah. So Sarab, you wanted to ask a question, so please go ahead. Unmute yourself.
Yes, Assalamu alaikum, everybody. Sorry, I feel bad talking about following the lady who just spoke. I think the thing, she was an example of what I was going to bring up, really. I don't know whether there is a lack of therapists who are Muslims or from our own cultures, because I think the lady, what she was trying to say, that somebody came, I'm a GP by the way, somebody came round, but actually I think a lot of my patients, a lot of my family and friends, is because there is not many. I struggle to, when you refer, obviously you can't specify, but I don't know whether there is lack of BAME therapists, psychologists, because this talking therapy, which is very helpful, apart from here's the prescriptions, but I think if they do not come from same culture, from same religion belief, then it is quite difficult to relate to what the patients are trying to explain, and the patient themselves do not get satisfied. And I wasn't sure whether there has been any work to, put up or increase training, or put up like a society for, therapists from different or minority backgrounds.
You are right, but I have seen that people are not even if you feel that you are being discriminated, you are not being offered a service, there is a BAME groups, BAME focus group for which work with each trust. I know within our trust there is a BAME focus group. So if even a staff or a patient who feel that they are being discriminated, they are not being offered the therapy that they should be, they could actually go to them. It's not only for that, even for day-to-day thing, like creating places for Muslims to break their fast, to pray. So the BAME group, focus groups, they can help support you with that. But you are right. If people are asking that they need a Muslim therapist, that can be difficult to find, So, and we need to encourage our people who are here to, to have their kids go into this specialty, become, doctors are quite a lot. I have seen lots of psychiatrists from our, cultural and religious background. But having psychologists, you are right, there are very few, far and few who are from, minority groups. So, yeah. There is a long, in the chat box, somebody has put.
Yeah, I think it's the same thing which you referred to. She has put like a website address.
Oh, okay. Is she the same person? Yeah.
Yeah, the same person. So yeah, I think Sumaya is one of the other sisters. I mean, she has put for that sister's help. That this is the website. Yeah.
Okay.
So Farah, you wanted to ask a question, so please go ahead, unmute yourself.
Yes, so I've been trying to do some research because I work with the BAME community in home support because there's a disparity between, mental health figures in the BAME community where they seek help in comparison to the white counterparts who do. And we've been trying to pin down like cultural barriers that might exist, especially in the postpartum period when it comes to women, and then those barriers that can lead on to mental health problems. So I was wondering if in your field you've seen any such examples. Maybe it's, for example, the one I can think of is that when a woman does feel a little bit down after a baby, she doesn't want to voice it because she will maybe sound ungrateful.
Yeah.
Something like that, if you've got any ideas.
Yeah, you are right. I have seen during my training, I worked in postnatal depression post for 6 months. And within our trust, we have got a perinatal consultant, Dr. Zurab. And I have sometimes referred people when one of my clients, they get, pregnant and I know that they are depressed now. It's the same things because of the stigma, because I don't know, in our culture, females take on a lot of things on them, so they feel like they could do it. They could just do it, and they just keep taking things on and on and on and on to the extent where they just break down, So we need to learn to say no. We need to learn to say it's enough now. I need time for myself as well. Yes, and I have seen two of my clients who were like from Asian background, and they both became depressed when they had a baby, and they were alone here with their husbands. There was no family support. They were not even having friends because they couldn't speak English. And even coming to the appointments were too much for them. Initially, their husbands were not allowing them to come to see the doctor, So there is a barrier at each and every step. So important thing is to ask for help, to have time for your own self. We can't just keep on taking responsibilities to the extent that we just break down at the end. So you are right, in postnatal period, that is a very critical period. So you need to have time to look after yourself as well when you are looking after a baby, and if you are already having kids, then it's again even more difficult, because you have got 2 other kids to feed, you have got 2 other kids to to look after, and at the same time you are having a small baby. But in postnatal depression, treatment is available. Your depression is treatable. There are specific perinatal services within each trust. They have perinatal psychiatrists, they have their own psychologist, they have their nurses who come home, you know, to see you, to see your baby, you know. So it's about asking for help and getting help in time.
Absolutely.
I'm also trying to go into counseling now, so it kind of just reminded me of when the previous sister was talking about a lack of Muslim therapists. So hopefully more of us will go into it now.
Inshallah, inshallah. That's great. Yeah, great initiative, inshallah.
Inshallah.
SA, she has raised a hand. So can you please unmute yourself?
Yeah. Assalamu alaikum, sisters. First, I would like to thank you for the very useful lectures. And honestly, I feel every illness needs a separate lecture. I know you went through it all. And to me, one thing, my first question is yoga is good for health, for mental health? You know, you mentioned about exercise and things. Do you think yoga will help? And the other things, you know, this group you mentioned, can you use it for a children as well, or are they just an adult?
Groups, which groups?
You know, the
IAPT.
Oh, IAP.
Yeah,
Are they useful? Yeah. Can you refer them for a, you know, like, because I know, is it if the child under 18, then they need special, you know, psychology?
I think they are mostly for 18 and above. For children to have psychological treatment, you need to go to GP and they can refer you to CAM services.
What
all
about
the camps?
If the parents doesn't want to go through GP?
Then it's, I don't think so. A lot of places they accept referrals directly, you know, from the, but what I can tell you, there are lots of psychological, private psychological companies.
Okay.
There is one which is, if you Google them, it will come up in your area.
Okay.
So they also, like in our Signet is a group within West Midlands who offer the private psychological support. So they don't need GP referral. You can contact them directly for any, you know, private psychiatrist or a private psychologist, psychotherapy work. So there are lots of those available if you don't want to go through mainstream CAMs or, you know, mental health services.
Do you know any, sorry, do you know any like Muslims one, or, you know, like?
No, I don't know about Muslims. Okay. Sorry, no. I think in psychology, I've seen lots of Caucasian, but there are minority, you know, ethnic minority background females are there, and they are quite good. You know, when you go there, they can give you options, especially in the private sector, that these are the names who you want to see, and you will have lots of options available. So.
Okay. Thank you. And is yoga is good for?
Yeah, yoga is a very good exercise because it relaxes you, you know, it calms you down. You have some time for yourself.
Breathing and all this exercise, you know, use breathing to concentrate.
Yeah. You can use breathing to concentrate. Even you can do the mindfulness techniques as well. You could Google them and you get the videos, you know, and you can start using those mindfulness techniques as well, where they make you feel more mindful of the here and now. Sometimes people with sleep problems, they can get better with the mindfulness techniques. And yoga is one of the very good exercise.
Sorry, just last question. I don't know. I mean, some people say if somebody's got depression, they will never come out of it. Is this true?
No, it's not true. You know, that's why I started the talk to say that don't think that these illnesses are not treatable. They are treatable. You know, it depends why in some people it does remain for their whole life. But there are a number of factors. You need to look at what is the precipitating factor, why it has come up. You know, you can't change that. But then there are certain factors that, you know, that perpetuating factors that keep it going. You know, if somebody is taking medication, antidepressant, but at the same time they are drinking alcohol, it's not going to improve. You know, In some people, if they are in an abusive relationship and that trauma is there throughout their life, they are taking treatment, it will improve to some extent, but then they need to go in another route, like couple therapy, family therapy kind of thing, you know. So you need to treat the cause, which is not only, so depression is a symptom, but at the same time, you need to look at what was the cause and how it can be improved, you know, to improve it. And I have seen people, that's why I can tell you the depression is categorized in two categories. One is just depression, and the other is recurrent depression. In some people, it come back, but others, it's just a unipolar one-off depressive episode.
Perfect.
So, yeah, it can get better.
Yeah, thank you very much. Thank you for your time.
Thank you very much, Bushra. That was really very useful talk. Jazakallah khair for that. Can I just ask one question, Bushra? You mentioned about the ADHD. So is that, is there an organic reason for it, or is it more because of the, you know, in the children which come from, let's say, from abusive home, family environment, or is the environment more important, or is there a organic reason for that?
There are a number of different factors that can cause ADHD. First of all, we need to understand that. The common things are, one is genetics, it runs in families. Second, if the mother is smoking or drinking alcohol or taking drugs during the time of pregnancy, their children are more likely to be hyperactive. Even if they are passive smokers, like if their partners or husbands, they are smoking in front of them when they were pregnant, it can actually make your child hyperactive. Third important thing, after birth trauma can cause ADHD. Sometimes they go through difficult birth, and that can actually, you know, they have brain injury, and that could actually lead to ADHD. Another thing that can keep it going could be even the diet can have an impact. Some kids I have seen, we just restrict their Coke, fizzy drinks, chocolates that make you feel hyper. It actually 40% it improves with that. So even the diet has got a role in there. And as you said, you are right, in some it is the stress, early childhood trauma, but the developmental disorder, ADHD, autism, LD, you are born with it. You know, it's usually during the pregnancy or the genetics that are playing role. It can make it worse with certain factors after the birth, like, you know, like I mentioned, the diet or a difficult family, you know, environment that can keep it, you know, or make it worse. But you cannot say that it's just because of this ADHD has happened. ADHD is a developmental disorder which has got multifactorial, you know, the causes. It's not because of one cause. But out of all developmental disorder, if I say which one I would like to have, would be the ADHD, because that is completely a treatable disorder. And you know, when you start them on an ADHD medication, which is called methylphenidate, you might have heard about it, Concerta, Medicaid. You give them first dose. This is the only medication where you see the effect the next day. They are so calm. They are so focused. You know, when I am now in psychiatry. When I look back, one of my cousin, I feel like he was ADHD. Could he be given treatment at that time? He would have achieved a lot in his life, you know, because he has lost all those early years in his school when he was not able to focus. Parents used to think some people, they have dyslexia. Parents used to think, oh, he's just making it up. He's just running away from the studies, or they just, you know, slap them. Oh, you can do it. You can do it. We need to understand why they are presenting that way. And I wish my cousin could have taken ADHD medication at that time. He has now seems like grown out of it gradually. He's now 40 plus, but now he can't go back and achieve what he should be achieving, you know, during his early years. So treatment can make a huge difference in ADHD specifically, and you can have a normal life. It's just like diabetes. As long as you are taking your, you know, the hypoglycemic agents or the insulin, your diabetes is controlled, you know. So ADHD is just like that.
Okay. Yeah, that's very interesting to know. So I think, yeah, I'm thinking probably in future we should plan a talk specifically on like these developmental disorders in the childhood,
Yeah, we can.
autism, and yeah. So we probably will bother you again, inshallah. in
Yeah,
future.
no problem. Inshallah, I would be more than happy.
Yeah, thank you so
I
much.
enjoyed giving this talk. No problem.
Great, yeah. Sorry, we are running a bit over time. It's just so interesting that we just keep on talking on it. So thank you very much
No,
for your
thank you.
time. Bushra, inshallah, we'll again invite you for another talk. It was lovely to have
Inshallah,
you
yeah.
with us. Jazakallah
No,
khair. Thank you very much,
thank you.
everyone, for participating.
Thank you,
Yeah.
everyone. Allah Hafiz. Bye.
Allah
Allah
Hafiz.
Hafiz.
Allah Hafiz.
Very much.
Very
Thank
good
you.
talk. Very good talk. I hope we have often like that too. Please,
Inshallah.
please, if anybody available, will be really like medication. Like medication, please. And thank you who sent me link. Thank you so much. I am really happy to hear that.
Thank you.
Alhamdulillah. Okay, thank you very much.
Jazakallah khair. Bye bye. Allah Hafiz.
Allah Hafiz.